Szczerba. I'm a board-certified plastic surgeon in Chicago, Illinois. We are in the O'Hare office at the Chicago Aesthetic Surgery Institute. And we're going to talk today about breast augmentation. And the way that I think it's easiest is to just talk to you as if you're a patient of mine and kind of introduce the whole concept of breast augmentation. First and foremost, we want to take a thorough history and physical and make sure that we're not missing any medical problems, things that would complicate your surgery. And then we go ahead and kind of talk you through the process, and that's where I'll take it from here. So thankfully, we're a very busy practice, and we do somewhere between 3 to 5 breast augmentations per week. It is not something that we do every now and again or once a month. It is something that we do all the time. And that allows us to basically make sure that we focus on getting your surgery done right the first time. I don't like to take patients back for complications or have patients be disappointed with their size being too big or too small. And so the first order of business is to go ahead and do a full exam and measure you for breast augmentation. So the process goes like this. I'll have you change into a gown. We'll stand you up and we'll measure 3 things. We'll measure you from the notch in your chest to each nipple. That first measurement actually tells us if your breasts are even, fully remembering that most women's breasts are not even. It also tells you, based on your frame, do you need a breast lift for your breast implant to look good? If the nipple is not centered on the implant, things will not look even and centered. And so for those patients, a breast lift may be required for things to look good. So that's the first measurement, being from the distance from the notch in your chest to each nipple. The second measurement is probably the most important, and that is the width of your breast. We'll measure the exact width of your breast, compensating for a little bit of soft tissue on each side to make sure that your implant is very rarely something that you can feel and definitely something that you can't see. So palpability and visibility of breast implants is best done with a conservative breast implant based on your breast width. So that's the second measurement. How wide is your breast? And then the third thing we measure is the pinch at the top of your breast, and that tells you, should your implant live underneath the muscle or is on top of the muscle even an option? When you pinch super skinny up here, do not put your implant on top of the muscle. You will see and feel your implant and possibly even see your implant ripple. So those 3 measurements, the distance from the notch in your chest to each nipple, the width of your breast, and the pinch at the top of your breast actually tells us quite a bit of information. And we use that to fit your breast implant. Once we have you measured, then there's 2 real things that we kind of focus in on in terms of a decision-making process with the patient. And the first order of business is the location of the incision. We have been performing breast augmentation surgery for about 15 years, and we have used every incision out there, whether the incision's in the armpit, underneath the areola, or underneath the breast. And back in my days in Atlanta, we even learned how to put breast implants in through the belly button. So based on all those entry incisions, there's a fair amount of data kind of showing that the incision underneath the breast is probably the safest incision for most surgeons, not for all, but for most. The second incision that is recommended is underneath the armpit, and probably the least used these days, or the least safe, is the incision next to the areola. And with that information in mind, you and I can kind of figure out together what incision is best to use for your case. So once we have the incision location determined with you, then the last thing we talk about is the implant itself. And there's 2 general categories for breast implants, saline and silicone. Saline and silicone both are good implants. Each has advantages, and I think the biggest advantage with saline implants is that the saline implant almost has like a built-in monitor. If your implant wears out with time, you get a flat tire. You know exactly when to call me. So I feel like the saline breast implants for a younger patient are perhaps ideal. 19 to about 26, 27, I'm always encouraging saline breast implants because it's usually a healthy patient coming in and is probably not going to see a doctor for anything on a regular basis for a number of years. So that built-in monitor becomes a little bit more important. For patients who are perhaps very thin or a little bit a little bit older, maybe perhaps in their 30s, and certainly anyone who's approaching or in the years that they would get a mammogram, I encourage silicone implants. Silicone implants are perhaps a little bit more natural in their feel, and because they are customized in the factory, there are a lot more choices. So in terms of shape and size, you get a lot more options than saline implants. Saline implants are very, almost 3 different sizes, but in 3 different shapes. Whereas for silicone, there's a lot more options in terms of size, shape, and feel. So it's almost, we've calculated it to be about 12 decisions to be made with you for a silicone implant, all of which we can help you within a few minutes, but it's just a matter of trying to almost customize your outcome. So with that in mind, why don't we go ahead and get started? I'll have you go ahead and get changed, and we'll go ahead and summarize the measurements one more time and then actually measure you. Okay, now that we've kind of picked out the implant that we want to use and the approach that we want to use in terms of incisions, why don't we go ahead and talk a little bit about breast augmentation surgery. I see you the day of the operation in the morning, and we go ahead and make some more of like marks that we use during the operating room to plan where our incisions would be and where the actual operation, the extent of the operation on you. We go ahead and take photos of our marks, and then we take you back to the operating room, and then use our general, we use an anesthesiologist or a nurse anesthetist to go ahead and put you under general anesthesia. The procedure itself takes about an hour, and when you wake up, most patients are not complaining of a lot of pain at all, because during the operation we'll go ahead and use a numbing agent, kind of like what you would feel at the dentist. So when you wake up, most patients aren't complaining of pain. If anything, they're complaining of a little bit of pressure on top of their chest. You're required to stay in the recovery room for about an hour. And after you get discharged from recovery room, then you go home and you take a nap or take a brief break and just relax for a little bit. I'll give you a call somewhere between 6 and 7 p.m. and just check in on your progress. Make sure that you remember to start your antibiotics that night. And then you rest easy that first night. We have a regimen that minimizes your exposure to opioids, so you don't have to take a ton of heavy-duty pain medications to get through an operation like this. In fact, most people are done with any heavy pain medications within a day or two. I'll see you on day 2 and make sure that everything that you and I talked about is just the way it should be. We'll let you go ahead and take a shower on day 2 at 48 hours, and I'll take a look at you live and in person on day 2. Once that visit is behind us, then I'll see you about a week later, and we will talk about implant massage. Then we'll bring you back 2 weeks later for your 3-week anniversary and actually remove 1 stitch per breast, and then you can start increasing your activities. Right at about 2 weeks, we kind of let you return to normal activities in terms of like heading back to the gym, but perhaps the first 2 weeks being important, not to lift anything heavy and not to raise your heart rate. But by week 3, you're doing fine, and you just slowly start reincorporating your activities. And by week 6, you can do everything you want. I discourage 3 exercises up until about 3-6 months, depending on the type of surgery that you had. And I discourage push-ups, bench pressing, and pull-ups for about 3 to 6 months, depending what operation you had done. After about 3 to 6 months, then you can do whatever it is you want. Your breast implants have settled in well. No matter what you do at the gym, it's not going to really affect their position unless you're a heavy-duty athlete. And there, for those patients, we do things slightly differently. The overall goal of the operation is to have a one-and-done operation that leaves you with very just the almost customized look that you're looking for, and something that it leaves you safe and happy, hopefully for the rest of your life, so you don't have to do any revisionary surgeries, which is always the goal. You want it done right the first time, which is why we strongly recommend using a board-certified plastic surgeon. And if you're not in Chicago, or if you have another doctor in mind, just check their credentials. We're always looking for the American Society of Plastic Surgeons. We take it from there. But if you have any questions, give me a call.